Hello, good evening. I hope everyone is doing well. My name is Bhavna and I'm from Fertility Dost. We are back again to spread more fertility awareness in our community. And this time we'll be talking about IVF. I hope I'm audible to everyone. Send me a quick hi or an emoji so that I know people are joining. We'll wait for some more time till the time we see some people joining us. Hello, everyone. Good evening. So, our topic for live today is how to prepare for IVF treatment. So, in case if you have any questions regarding IVF, you can comment us down. We'll be having Dr. Divyashree with us, who will be explaining us what is IVF, the process, who should opt for IVF, who should not opt for IVF, the precautions that you need to take, and everything related to IVF. So, all your doubts and queries will be answered by Dr. Divya herself. Meantime, just send us your questions. Okay. Good evening again. This is Bhavna here from Fertility Dost, and today we'll be discussing about IVF. So, if in case you're going through IVF and you have questions regarding the process, the things you need to take care about, precautions, or anything related to IVF preparation, you can send us your questions to discuss the same about how to prepare for IVF. Today we have Dr. Divyashree with us, and she'll be explaining us about IVF, the myths regarding it, and in detail about IVF. So I would request Dr. Divyashree to join us on screen. Dr. Divyashree is having 16 years of experience and she'll be joining us soon. And hello, ma'am, good evening.
Hi, Bhavna, and hi, everyone.
We
Good
have
evening.
Dr. Divyashree with us. I'll just give a quick introduction about her. Dr. Divyashree is the medical director at Genia Fertility Center, Bangalore. She is the recipient of the Future of Art, as well as she has contributed awards and is part of the fellowship teaching program at Genia and Milan. Along with this, Madam is member of State Board Art and Surrogacy Act 2021 and is also a secretary of Indian Fertility Society Karnataka chapter. Ma'am has got total 16 years of experience into infertility, whereas her expertise is about infertility and recurrent implantation failure. Dr. Divyashree, with so much to say about you, we are glad that you have joined us for this topic where we'll be discussing how to prepare for IVF treatment. Lots of things are about IVF. There's lots of myths and there is a lot of hype also about the same, whether it's really helpful or not. So, ma'am, can you just help us and our viewers to understand what is the IVF process?
Yeah. Again, good evening, all of you. Yes, this is an emotional journey. It's an emotional roller coaster when people go through this infertility journey, and especially when they're going through IVF. There are lots of doubts, anxiety, and whether it is going to work or not. So there are lots of doubts, and they just go through a lot of emotional roller coaster because initially, why for me? Why infertility for me? Why only me? My peer, everyone has got married at the right time. They have got children at the right time. Why for this pregnancy I have to struggle a lot? So already, those who are facing this issue are emotionally weak. They are anxious. They are depressed. So and this IVF is totally new to them, and obviously there will be a lot of anxiety and stress within them. So, what is this IVF and why do we have to do this IVF? If we have to understand, there are mainly four indications for an IVF. Initially, do you know when Louis Brown was born in 1979, the IVF was done for tubal factor infertility, which means both the tubes were blocked. So initially, IVF, in vitro fertilization, was done for tubal factor infertility. When the tubes are blocked, egg and sperm cannot meet. So when the egg and sperm cannot meet, embryos cannot form. That is what that which means the fertilization cannot happen inside the womb, that is inside the tube. So that is why this in vivo fertilization is not happening. So we had to do in vitro fertilization. So the main
Mhm.
indication for IVF till date is tubal factor infertility, which means the tubes are blocked. Why do you think tubes are blocked? Most commonly, the tubes are blocked because of iatrogenic, or it is blocked purposefully. For example, when people go through family planning operation, that they have delivered one child or two children, and after that they want some contraception, they want the tubes to be blocked artificially. So that's called tubectomy. That's the most common reason. Or it could get affected because of infections. India is a country where tuberculosis is not very uncommon. Tuberculosis is the most common reason why tubes can get blocked. Most of us think that TB can affect only lungs, but it can affect
Mhm.
any organ in the body, and reproductive organs are not spared. And among the reproductive organs, which is uterus, tube, ovary, cervix, vagina, tube is the most commonly affected organ by tuberculosis. So when the tuberculosis affects the fallopian tube, it can get blocked. It's not just tuberculosis, it could be other genital infections like chlamydia infection, it could be gonorrhea, or any other sexually transmitted diseases which can affect the tube. Or it could be a surgery. For example, a woman has gone through appendicectomy procedure when she was young, and it has caused adhesions. In that case also, tube can get blocked, or the tube and ovary relationship gets altered. Most of the times in endometriosis, there will be adhesions. The tube can get adherent to something else. So that could be the reason. Or there could be dilatation of the tube called hydrosalpinx. So to put it in a nutshell, the most common indication, the initial indication with which the IVF was started was tubal factor infertility, where the tubes are damaged or blocked. The second indication is endometriosis. What is endometriosis? Endometriosis. Imagine you get menses every month. You all know that you get menses every month.
True.
In, when you get menses, the blood from the uterus flows out through the cervix and the vagina. But if the bleeding happens inside the pelvic cavity, which could be in the ovaries, it could be in the peritoneal surface, wherever it is, if the bleeding happens, the menstrual bleeding happens inside, there is no passage for it to come out. So the menstrual blood keeps on accumulating. So whenever there is bleeding, there is inflammation and adhesion. For example, you get a cut on the skin. How does it heal? It heals with inflammation. There will be a lot of redness, and there will be pain, and then it heals, right? So the same way,
Mhm.
whenever the bleeding is there inside, that's called as endometriosis. In endometriosis, again, there are different stages: one, two, three, four. If it is stage 3 or 4 endometriosis, again, it's an indication for IVF. So that's the second indication. Then what is the third indication? It is severe male factor infertility, where a man has got severe decrease in count, or it could be even azoospermia, where there are no sperms in the sample, or it is just 1 or 2 million count on the semen test. Then also it's an indication for IVF. And if you ask me why, because normally when people have intercourse, millions of sperms get deposited in the vagina. When it enters the uterus, it is lax. When the sperm enters the tubes, it is probably hundreds to thousands. So to fertilize one egg, we have to have hundreds and thousands of sperms surrounding the egg. So when the sperms which are getting deposited in the vagina itself is less, so the
Mhm.
probability of sperms reaching the egg in the tube will be very less. So that's how the probability can come down. And needless to say, when it is azoospermia, when there are no sperms in the semen sample, then obviously there is no scope for fertilization and subsequent pregnancy. So when it is a severe male factor infertility, a sperm cannot fertilize the egg on its own. Here we have to do it artificially. We have to take the egg
Mhm.
and inject the egg with sperm individually, one egg with one sperm. That's called as intracytoplasmic sperm injection, which is one step ahead than IVF. So that's also an indication for IVF, which is severe male factor. So to just a quick recap so far, the first indication is tubal factor. The second indication is stage 3 or 4 endometriosis. The third indication is severe male factor infertility.
Male
And that too, it is
infertility.
severe.
True.
And that too, it is
So,
severe. Not all mild male factor infertilities are indications for IVF, but it is severe male factor infertility. And the last indication is unexplained. I would, in medical terminology, it is called as unexplained. I would call it as unexplored infertility, wherein there is no such reason why pregnancy is not happening. How do we term this or coin this term unexplained infertility? Is when the basic investigations are normal, which means a woman is ovulating, she's having regular menstrual cycle, her egg reserve is okay, she's got good number of eggs. Then also the semen analysis is normal and the tubes are not blocked. These are the three basic investigations for us to say that she's not having any cause, explainable cause for infertility. That's called as unexplained infertility. So whenever there is an unexplained infertility, first thing is, what do? We just track the ovulation and we tell them try naturally, or we give them medications,
mhm.
few medications, so that instead of one egg, she releases two eggs, and then tell them to try naturally. That's called as timed intercourse. If timed intercourse doesn't work, then we do an IUI procedure, that is intrauterine insemination. Why do we do an IUI? We are trying to increase the probability of pregnancy by increasing the number of gametes, that is, eggs and sperms, which are available for fertilization. By doing an IUI, we are increasing the sperms which are available for fertilization around the time of ovulation. So when timed intercourse fails, when IUI fails, that is when we resort to IVF. So in unexplained infertility, where previous medications have failed or previous interventions have failed, that is also an indication why we have to do an IVF. In unexplained infertility, needless to say, it also includes polycystic ovaries. What happens in polycystic ovarian syndrome? A woman does not ovulate regularly. So the simple treatment in the polycystic ovarian syndrome is to induce ovulation, to give medication so that she ovulates at the right time, and we tell them to have intercourse. If that fails, then we step up the treatment to ovulation induction, which means we make sure that the egg gets released and we do an IUI. When IUI also doesn't work, then almost she comes into the category of unexplained infertility, because we don't know why pregnancy is not happening. If the basic defect was just ovulation problem, she should have conceived with ovulation induction programs. So if it's not working with the routine treatment, then also we step up to IVF. So the four indications for infertility is when it is the first indication, as I told you, is the
The
first
blocked
one,
fallopian tubes.
the blocked
True.
fallopian tube. The second one is severe endometriosis, that is stage 3 and 4, severe male factor infertility, and unexplained infertility, where the previous treatment modalities have failed.
True. So for all the viewers, ma'am has even concluded it that there are four reasons, and need not be every endometriosis stage has to end up for IVF treatment. She has very well explained that it has to be the stage 3 and 4 and not the 1 and 2, as well as Then there are male infertility also, where it has to be a severe cases. Only on the cases where there is severity, where they have tried everything, and then there is IVF for all these cases, wherein it is blocked fallopian tubes, endometriosis, male infertility, as well as unexplained infertility. Ma'am, I really like the way we have put on it. It is unexplored infertility, the side which is not explored, and that has caused them infertility. So once it's explored with the right doctor, your infertility is just gone. This is what is beautifully ma'am has put it across. Now that we have talked about it, who can opt for IVF, or what are the cases who can opt for IVF, we would like to hear about the entire IVF process. So people who are opting for IVF process can ask us about any other questions that you have. Ma'am would now be explaining us what is the IVF process step by step.
Yeah. So IVF process. Here I would like to segment this process. Okay. One is preparation for an IVF, which I'll take it later, and the IVF procedure per se, and that is still egg pickup, and after that preparation for embryo transfer. So let us understand up to how till egg pickup, what are the steps which are involved. There are different protocols for an IVF. So why is that IVF is so complicated if you think? Naturally, every woman will release one egg, yes or no? So, with one egg, we cannot work with these eggs and sperms. It is just that we just get one embryo. But believe me, the first IVF baby which was born, that is Louis Brown in 1979, was with a natural cycle. One egg was picked up. It was injected with one sperm. It found one embryo and resulted in a pregnancy. And this baby, she has delivered normally. She has conceived normally.
True.
Okay,
Yes.
but it is a Herculean task just to deal with one egg, because lot of financial aspects are involved in this, and lot of laboratory processes are involved in this. So if we have more number of eggs, we can work on them sufficiently so that we get more number of embryos. So why do we have to get more number of embryos? It is because we are looking at a cumulative pregnancy rate. Because
True.
with one IVF, when we do one embryo transfer, wherever it is, wherever in the world, the best IVF center can give a probability of 40 to 50% in an
Hmm.
indicated IVF. So, which means 50% would fail. This is the reality which we have to understand. So if you have
True.
to do repeated embryo transfers, we have to have more embryos. More the merrier. When we have more embryos, we can keep repeating this embryo transfers cycle after cycle. So if we have to get more embryos, we have to have more eggs. Sperms we will get, because sperms are in million. When with one ejaculate, we get millions of sperms. But we have to have more eggs, right? So if we have to have more eggs, we have to give injections. Every menstrual cycle, a recruitment happens, which means few cohort or group of follicles will enter the process of ovulation, but only one can make it. Why? It is because the other subordinary follicles or subsidiary follicles will go through atresia or they die. Why is it that so? Because only one particular follicle or one particular egg can respond to the lowest dose of gonadotropins, which is released from the pituitary, that's in the brain. So, if we increase this FSH dosage, even the subsidiary follicles can grow, so that we get
Mhm.
more and more eggs. So for this, what we do, we usually, the most common protocol is we start the injection from second day of menses, which, so the injections will be there every day. Every day injections will be there. And how many days of injections? Minimum 8 days to maximum 12 days of injections will be there, which has to be taken from second day of menses. And in between, the response is going to be assessed. And how do we assess this response? By doing a scan. That is the most common modality of assessing the response. We can also do blood tests to correlate whether it is correlating with the hormones. One
Mhm.
follicle, if it gives an E2 value or the estradiol value of say 100 in its initial stage, so if we have 5 follicles, we should have 500 value as the E2. And on scan, we assess the size of the follicle. Follicle is just that it's like a fluid filled balloon in which egg will be there. Egg is not visible on ultrasound. It's a microscopic structure. When we do the egg pickup, we can see that under the microscope. So we do the assessment once in 3 days, 2 days, 4 days, depending on how many eggs she has and what is the rate of development. Then in between, we may do 2 to 3 scans. and we may do
Mhm.
2 to 3 blood
Sorry to
tests.
interrupt you, ma'am. We have just got a question from our live audience where she is asking the same question on the same line where she's saying she has got PCOD. So, in case of these hormonal injections that she'll be also injected in the coming future where she's planning her own IVF cycle, the number of eggs that a PCOD patient gets as in comparison to a normal patient who is not suffering from PCOD are the same or it may differ?
It's
The
an
number as well
excellent
as the
question.
quality of egg.
It's an excellent question. PCOS means there are polycystic ovaries, which means there are many number of eggs. To have very less number of eggs or to have many number of eggs is also a problem. It should not be too less or it should not be too many. As our patient has rightly suggested that yes, PCOS will have more number of eggs, so they will get more number of eggs when we retrieve. So it's in a way it is good because as I told you,
Mm-hmm.
it's more yeah, but it comes with a risk that is called as ovarian hyperstimulation syndrome, wherein if we have too many follicles, the ovaries can get too huge, and there could be fluid accumulation in the tummy. There could be vomiting, and there could be concentration of blood, which can lead to other complications associated with OHSS. So a woman with
Mm-hmm.
PCOS will definitely have more number of eggs compared to a woman who is having normal egg reserve or who is having less egg reserve. So, accordingly, complications are also higher. That is why when we
True.
start the injections, we have to be very vigilant about what is the dose
Hmm.
that she requires. And how do we decide
Okay.
on the dosage? It depends on what is the age of the patient, what is the body mass index, or what is her height and weight. Accordingly, we have to calculate the dosage. What is the AMH level? In a PCO, AMH is going to be high, so my dosage is going to be lesser. And how did she
Hmm.
respond to the previous cycle? Most of these patients, when they come to us for IVF, especially in tertiary centers like us, they would have actually gone through 1 or 2 IVFs before and failed, and then that is when they come to us, or at least they have gone through IUI procedures. When we
Mhm.
look at these stimulation protocols, we almost understand with what dosage, what is the threshold dosage for this particular woman. So that is how we have to decide on the dosage. So once we decide on the
True.
dosage, these injections will be given for 8 to 12 days. In between, monitoring will be done, and we give the final injection called the trigger. It could be either a HCG trigger or it could be called as
Mm.
agonist trigger. And then once the trigger is given after 35 to 34 to say 36 hours after the final injection, we do the egg pickup procedure. Egg pickup
Which
procedure
is the
is
second
just
second step.
no, we are
You
still
just
in the
we just
first
name
step.
it. Okay. Okay.
When we segmented that, one is the up to egg pickup. So till the egg
Mm-hmm.
pickup, so now the injections are over. Now we are getting ready for egg pickup. So egg
Mm-hmm.
pickup procedure is a simple procedure. It's not something like it's a very big procedure where we have to do a laparoscopy or we have to cut open the tummy and take. No. When we most of our women who are suffering from infertility are very familiar with transvaginal scans, right? So when we do
True.
the transvaginal scan through the same transvaginal probe, a small needle will be passed which enters through the vagina and enters the ovary. Especially when it is a stimulated ovary, it is going to be much easily accessible, and we just puncture these follicles and retrieve these eggs. So this eggs will get, it will just drop into the test tube. That's why the term the terminology test tube baby came from. So the
Okay.
egg drops into the test tube. From the test tube, we segregate it into the petri dishes, and then we actually observe that in the lab. So this is how egg pickup is done, and it will be done under small anesthesia procedures. Many times it can be done even under local anesthesia, but most of our patients are already apprehensive. So that's why we prefer to give sedation, which means they are sleeping during the procedure. It's not like intubation procedures where they are totally paralyzed. It's only that they get into deep sleep. Hardly this procedure takes 5 to maximum 10 minutes. And then the
Okay.
eggs are retrieved. So this is the first stage. The first stage gets over.
We
After
have
this,
just got
what
the
happens?
same question, and in a similar way, there is this woman who is saying that she is a working woman, and she's
Yes.
saying that will I be able to go to office the next day?
Absolutely, absolutely. Whether you are going through injections or going through a pickup, the same day I would not advise you to go because you will feel
True.
drunk because of the effect of anesthesia.
True.
it's a free ride of getting
Mm.
stoned with anesthesia. It is just the same feel. For some
Yeah.
it can be a very pleasant feel, for some it can be not very pleasant. But however,
True.
we would not advise them to drive or work on the same day of the procedure, but the subsequent, the next immediate next day, they can go for work. It is not just
True.
after the procedure, even during your procedure of going through injections, you can self administer these injections because they are all subcutaneous injections. It's just like taking insulin injections. Most of the diabetic patients, they
Mm-hmm.
administer injections themselves, right? Same way, women can administer the injections themselves and just come for monitoring 1 or 2 days. Basically, it has to be friendly, patient friendly. There should not be much of waiting time,
True.
trying to meet the doctor and then getting the drugs administered. It should be very friendly. So that's how it is. And as I was coming back to the explanation of what
The
happens
process.
after neck pickup, because most of you will be apprehensive. What will they do with our gametes? Because they are little human beings, they are going to be
True.
future children. How are they going to deal with our gametes? So these eggs are like, they're very sensitive. Naturally, these eggs are meant to be in a closed environment where it should be dark, and it should be maintained at a
Mm-hmm.
core body temperature of 37. Our core body temperature is 37 degrees centigrade. So it has to be maintained in that temperature. It should not be exposed to light. It should not be exposed to colder temperatures, and particular pH has to be maintained. So that is what is done in the IVF lab, which is the core of any IVF procedure. So it's like a sacred place. IVF lab is a sacred place where too many communications are not allowed. Too many people cannot enter the IVF lab, where all these small, small little human beings are preserved. So these eggs are immediately, because these eggs have gone through a shock. Naturally, these eggs are not meant to be going through this pressure line and then falling into the test tube. So they are totally shocked. So we have to keep them in the incubator for some time so that they get stabilized. After that, then it will be
Mm-hmm.
taken outside. When it comes outside, it comes as an oocyte cumulus complex. The supporting cells also get surrounded the egg. That will be denuded. The oocyte will be separated from this cumulus complex. Then either it is ICSI procedure is done, where single sperm is injected into the egg artificially. That is the ICSI procedure. But if it is an IVF procedure, the oocyte cumulus complex will be left with lakhs of sperm, so that sperm fertilizes the egg on its own. Then we observe this fertilization 24 hours or 12 to 24 hours in this time gap, whether it has formed a zygote. That is, egg is an individual cell, sperm is an individual cell. When they meet together, they should form a single cell called zygote. From this single cell, it should
Mm-hmm.
become two cell, two should become four, four should become eight, then it should become a compaction stage embryo called morula, then it should become a blastocyst. So overall, in this 5 days journey is what it happens in the IVF lab. So after that, either we transfer the embryos back to the uterus or we freeze them. As I told you, we try to get as many eggs as possible, but it should not be overzealous and it should not exceed, say,
True.
12 to 15 eggs. The healthy
Okay.
numbers are somewhere between 5 to 15. It should not be beyond 15. That's called as ovarian hyperstimulation syndrome. As one of our previous lady asked, that she's a PCO. Yes, she can get more
True.
than 15, but that is the duty of a doctor, to mitigate that kind of a hyper response and make to get them back to the track. That is to just have, say, 10 to 15 eggs is what a good number. So if
Mm-hmm.
we get, for example, if we get 10 eggs, okay, it is not that every egg will get fertilized and every egg or the fertilized egg will become a fifth day embryo. Usually
Mm-hmm.
80% is the probability. If we get 10, we should have something like 7 to 8 blastocysts, provided it is a healthy egg. IVF is both
Mm-hmm.
diagnostic and therapeutic. As I told you, unexplored or unexplained infertility, when we do an IVF, we get a lot of answers. Many a times,
True.
we get to know what is the quality of the egg. It's very easy to diagnose male infertility. Tell me why? Because just by giving a sample, we can understand how the sperms are, what is the number, what is the motility, what is the quality, how many are dead, how many are alive. But we cannot do that with an egg. If we have to
True.
understand what is the quality of the egg, we have to retrieve it outside. So IVF is a good opportunity for us to study the egg, how the eggs are looking like, whether they are mature enough, they are having any abnormalities within the egg or outside the egg, the supporting cells. Is the sperm and egg interacting with each other? are they getting fertilized, or after the formation, whether the embryos are getting formed or not. So we get a lot of information.
We are just running a little short of time, ma'am. I'll just take up this question, which is related to our content, our discussion right now. Whether the patient is saying that she was recommended to have a 3-day embryo transfer, wherein we are emphasizing here on the fifth day transfer. So she is asking us, where we'll just give a quick reply to our viewers because we have a little short of time.
Yes,
So,
right.
how to pick up the best embryo for the transfer, whether it's a day 3 or a day 5?
There is nothing like one size fits all. I'm not saying we have to do a blastocyst transfer. We do both 8 cell, that is third day transfer and fifth day transfer. That depends on your treating doctor, because many
Mm-hmm.
a times is a better incubator for the embryo to grow. And many times we want to study the embryos further. What is happening? What is going wrong with the embryos? Is it really good that it could get implanted? So that is when we suggest a blastocyst transfer. And even if we look at the evidence, whether it is day 3 embryo or day 5 embryo, the implantation or the live birth rates are the same. So it's nothing like day 3 only
Mm-hmm.
has to be done, day 5 only has to be done. There's nothing like that. So just quickly, if I have to
Great. So I
complete,
think,
so once the embryos are
yes.
formed, then it is preparation for the embryo transfer, which could be either in a fresh cycle or a frozen embryo transfer, wherein we prepare the lining, make sure that the lining is good, and then transfer the embryos back into the uterus. So this explains the whole IVF process.
Great. So to the viewers who have been asking us whether it's a day 3 or a day 5, it depends upon your condition as well as what the doctor has felt is the right embryo to transfer to increase the chances of implantation. Having said that, there is also questions which our viewers have asked us in the community that why does an IVF fail? And this is the right question to ask you because you have got an expertise in recurrent implantation failure. So I'm sure ma'am can explain this question to our viewers.
This is my favorite question. I want all of our patients who are going through an IVF to be prepared for a failure. For this, you have to understand what is a normal human fecundity, which means what is the ability of a human being to achieve pregnancy in one menstrual cycle. 100 couple are trying for pregnancy this month. Whether all 100 will achieve pregnancy? The answer is
Hmm.
no. Because only out of these 100, 15 to 20 maximum will achieve a pregnancy. Rest of the 80 will not achieve pregnancy. Does it mean they have problems? No. What will they do? They will try again next month. Does it mean all the 80 will get pregnant in the second month? No. Another 10 may get pregnant. So another 70 will try for the third month. So when they keep trying at the end of 1 year, the probability goes up to 80 of them would
Increases.
conceive, right? The same way. And it is the normal, it is nature. That's how God has made us. For example, if you take a cockroach, if you take a mice which enters our house, how fast they reproduce? They produce litters. A cat delivers 6 kittens. A dog delivers 6 puppies because they have a shorter lifespan.
True.
So, to maintain their progeny, they have to produce quicker, they have to reproduce a lot. Compared to an elephant, the fecundity of an elephant is much lesser than a human being because they live much longer, for a longer duration of time
Mm,
compared to human beings. And the
true.
total duration of pregnancy is much longer for an elephant. So as a living being in this nature, in this universe, we come with a fixed fecundity rate of 15 to 20%. So, in an IVF, we have come through an IVF because there is an indication which, with all these four, and with all the probabilities, with the highest expertise and the finest embryology lab, what we can attain is only 50%. When you enter an IVF, I want you all to be aware of this probability of pregnancy, because it's very important to understand what is the actual pregnancy probability. We enter
True.
this with this pregnancy thinking that IVF is a panacea and I'm going to get pregnant 100%, and we raise our expectations like this. And when it comes as a negative
The
result,
reality.
boom, we just drop from 10th floor. That is what is the problem which all of our patients are facing. So we have to understand 50% is the probability of pregnancy. But there is
Mm,
something called cumulative pregnancy rate. So when it fails for the first time, when we do an embryo transfer second time, the probability goes up to 75%. When we do it for the third time, the probability goes up to 87.5%, which is close to 90%. So this is what we have to
true.
understand, because even with an IVF, the probability of pregnancy is 50% each cycle. And
True.
even
It's very
after the
important for
third
the viewers to
IVF,
understand. IVF doesn't give 100% solution to it, though you have
exactly.
to be patient. But doctor, as you were just saying it, and I wanted to, emphasize and highlight this particular thing is, as you're saying, the patient needs to be aware and they should be prepared rather that it's not going to be 100%. Though we are not saying that every time it's going to be a failure, the chances are high that you might have to go for a second chances. And if the IVF phase, the feeling is as good as falling from the 10th floor. So preparation is the key. So how would you like to say in a holistic way? I mean, always there are injections and there is a preconception test always helping them out, but do you think holistic way will help them out to prepare well for the IVF? And if it's holistic, how they should prepare?
Definitely. See, first of all, have a healthy lifestyle. Most of you are most of the times glued to internet, or most of you are so workaholics. Most of our patients, they tell us, how often do you have sex? How often do you meet? They tell us, we are, we can meet you in the clinic. That's the time when we get to meet together. Then how do you expect them to
Right.
get pregnant? So first of all, spend
Exactly.
time with yourself, understand each other, and it is a spiritual process both for doctors and patients. So meditate a lot, exercise a lot, and cut down on the calories. First, be healthy, because most of the times what
True.
you people do, or most of our patients do, is to just become, stagnant. They just go to bed rest, which is totally, a blunder to do. I don't advise
Hmm.
any of my patients to take bed rest, any of my patients to just keep taking injections. No, you have to be very active, because remember, if you exercise, there is good blood flow to the system. Anything, whether it is heart, whether it is kidney, when you exercise, there is good blood flow to the system. How is uterus a different organ? Uterus also needs blood supply. When uterus gets blood supply,
True.
embryo gets blood supply, right? So if you're exercising, then your uterus gets better blood supply, and that's how the probability of pregnancy can be higher. So prepare
Great.
psychologically, and then get pregnant for your own sake, not to prove the world, not to prove others that okay, even I can get pregnant. You want, or not with the
Exactly.
peer pressure or the family pressure. You want to have a baby. What is the right time to have a baby? When you want to have a baby, and we are here to help you.
True.
And as I told you, diet, exercise, mental preparedness, or to be calm, to be prepared for a negative result. When you prepare for the worst, best things would happen to you. Don't have too
True.
much of a
True.
high
Beautifully
expectation.
said, rather.
So
Exactly.
that's
So
how
it's a
I
holistic
want you to.
preparation. True. And it's as well as with holistic, it's also mentally getting prepared and being prepared for the worst as well will help you to go through this journey. And as doctor has very rightly said that you're not ill, that you need to go for a bed rest. Rather, you have to be active. You're going through a spiritual journey. And you have put it very beautifully, doctor. I would rather say that IVF is nothing that you have to get scared of, or you have to be like, oh my god, I'm going through IVF, I have to take leaves, I have to go home, I have to rest, nothing I'll do. No, it's the opposite. You have to be more active. You have to prepare yourself. Your body should be active. A proper diet has to be there. You have to maintain your BMI. You have to maintain your exercise and mobility, and as well as mental preparations. So if you're prepared in this way, only then you can have your IVF in a better chances of success, rather, I would say. There was this last question coming up who said that 50% chances in the first IVF cycle only, or how? So I would say ma'am has given a lot of explanation that it's also the cumulative chances of success that you get with each cycle that you go by. So and preparation is the key, as we have mentioned that our topic was how to prepare for the IVF treatment. So how do you prepare is you have to prepare by yourself, by thinking and giving importance to yourself as well as to your spouse, and not just going and meeting the doctors in the clinic, because you won't get pregnant like that, is what doctor has said us. So thank you so much,
So
doctor, for giving us your time. It was wonderful talking to you. You have given us so much insights and have explained in detail. I hope viewers have noted it down. And in case if you have any queries or you would like to meet Dr. Divyashree or consult her, do let us know. Thank you, Dr. Divyashree. Have a great evening.
thank you so much. And whoever is going through this journey of IVF, I wish them all a, happy journey through this parenthood. And IVF is a different, it's a different choreography. It's an altered choreography, but that does not mean it's abnormal. So you will get
Exactly.
pregnant. It's just that positivity within you which keeps you going.
Great. So with this positivity, we are signing off.
Yes.
Good day.
Thank you
Bye
all.
bye.
Good. Bye.
Bye bye. Bye.